Hi, everyone. I hope you're all keeping well, safe, healthy, and sane in these difficult times. Thank you for joining our Policy Lab today on the COVID-19 epidemic in Palestine. We organize this online streaming space once a month to discuss important topics like the coronavirus pandemic, which has reached Palestine and which has revealed power structures that render Palestinians particularly exposed to the virus. And so in this discussion, we don't look at the epidemic in Palestine or at the PA's or Israel's responses to it as isolated events. We rather want to advance a more historicized approach to the epidemic by examining it within the larger framework of settler colonialism. And that's why we're very happy to have with us today Osama Tanous and Yara Asi. Osama Tanous is a specialized pediatrician based in Haifa, and he's a master's student in public health and a researcher in the Galilee Society, the Arab National Society for Health Research and Services. Osama is also a 2020 candidate for a Fulbright Fellowship in Public Health and Health Policies. Alf Mabruk, Osama. And Yara Asi is a lecturer at the Department of Health Management and Informatics at the University of Central Florida. Yara's work looks primarily at health, education, and development in war-affected zones, but she also has published on other topics such as food sovereignty and food security in the Palestinian territories and foreign policy and foreign aid policy in fragile states. And I am Noor Arafeh. I'm a PhD student at the University of Oxford and a former policy fellow of Al-Shabaka, and I will be facilitating this policy lab. So just FYI, we will be taking your questions online through the Q&A feature at the bottom of the screen. So please ask any questions you have. I will first have a quick discussion with Osama and Yara for like about 25-30 minutes, and then we will open the floor to your questions. So according to the Palestinian Ministry of Health, as of today, a total of 260 cases have been detected in the occupied Palestinian territories, including 13 in the Gaza Strip and 1 death. Unfortunately, the ministry doesn't have a comprehensive account on the number of cases in East Jerusalem due to Israeli-imposed obstacles on PA's access to data concerning Palestinian patients in Jerusalem. And the issue of data is something we will discuss today. But first, Osama, given the rise in the number of cases in Palestine, to what extent is the Palestinian healthcare system equipped to deal with an outbreak of the coronavirus in the future?
Okay, hi. So hello to the audience, and thank you, Noor. I think like this is a very large question, and there's a lot to unpack. I will start with talking in the beginning about the larger framework of healthcare under occupation and settler colonialism, and then we can start tackling the fact. So what we know as doctors from medical history, that always epidemics or other natural disasters, they expose an ongoing power structure, and they mostly kill the most vulnerable populations and the most fragile or impoverished people living on the margin. This is a recent example is Hurricane Katrina in the USA, where the majority of the people that died were blacks, poor, and uninsured. And it raised a lot of questions. So if we want to talk about healthcare in Palestine, we need to remember that, and especially for our audience that is not very much familiar with the geographies, the fragmented geographies of Palestine, that when we talk about the West Bank and Gaza, we do not talk about a geographical unit. These are not given units or given islands with definite borders. So Gaza is an artificially created strip of land that was created and drawn as a border by an Israeli military expansion and is now under siege. The West Bank was also, its borders were shaped by Israeli military expansion, by the wall, by settlements, and are still being reshaped by colonial, by Israeli wanting to impose its sovereignty over the Jordan Valley and so on. So these are not given geographical units, and most importantly, they do not have sovereignty. So if you do not have sovereignty over your land, your import, export, your access to resources, your access to land, basically, and you mainly lack planning. So it's very hard to, and we've been having these discussions with, with doctors in Gaza, from the simplest stuff, whether to plan a program for screening for iron deficiency in children, or for, a chemotherapy regime for patients. You cannot, it's very hard to make long-term planning when you don't control your land, and you don't know what medications or what equipment you will have for the long term. And so in Gaza you have the siege. In the West Bank you have several walls, checkpoints, settlements, so on, that truly restrict your accessibility to any kind of healthcare. So given that, and on top of that, historically the Palestinian healthcare system, due to this complicated history, has been just this complex mishmash of networks that has several healthcare providers, including the Palestinian Ministry of Health, including the UWA, which was recently heavily defunded by the USA, including several non-governmental organizations, and local and international, and a very complicated permits regime to Israeli hospitals. So that is also another tool of control and of political pressuring. So given all of that, everyday healthcare services in the West Bank and Gaza are very much inaccessible, delayed, fragmented, broken, unequal, and that on everyday basis cause a lot of avoidable and unnecessary death and disability and misery and so on. And all of this fragile system is put into a test when such pandemics come, and they truly expose how fragile and how dependent the Palestinian population in the West Bank and Gaza is. And we can also see this happening after every cycle of Israeli war or military aggression and so on. So if you remember the Israeli attacks on the Great March of Return in Gaza, the hospitals were completely flooded with trauma patients and injuries. So the fear with such contagious virus, and if we see very successful and well-established healthcare system in other parts of the world, in the enriched global countries of the global north that have universal healthcare and have sovereignty and have planning and disaster management team, are having such a hard time facing this virus. For the Palestinians, it would be much, much, much harder. And because of all these historical, all of these conditions made by the Israeli occupation, and in Gaza also by the Egyptian siege on Gaza, that makes it also harder. So it's a very fragile and weak system. And also the population per se, the Palestinian population, due to this also impoverishment by colonialism, due to alienation from the land, forced urbanization, different processes, this has made the Palestinian much more, as a population, I would say, much more diseased and sick. And so if we would look at the health statistics of the entire population in the West Bank and Gaza, you will see relatively higher rates of lung diseases, what we call COPD, chronic obstructive pulmonary disorders, heart diseases, uncontrolled diabetes. All of these conditions make coronavirus a much more deadly disease. And of course, when we talk about crowdedness, impoverishment, all of these make the COVID epidemic potentially very deadly in the West Bank and Gaza. And of course, on top of that, we need to remember that you have Palestinians also in Israel. So the native indigenous Palestinian who remained in their land in Israel, and these are also have been facing. They also face a much worse healthcare status compared to the Israeli Jews. Also live in much more crowded towns that make them more susceptible, and also their accessibility to healthcare. And recently, what we saw as the racialized testing of the Israeli government, where they've been almost not testing Palestinians citizens, very little. So that has created a lot of misinformation and lack of data. Of course, Palestinian refugees are an entire different story where they're completely dependent on UNRWA and on donors for testing and treatment. So in large, we can see a very fragmented and broken system that can really fall onto its knees by the pandemic.
Thank you, Osama, for this historical, contextualized account, especially because you traced the history of settler colonialism and how it can inform how the epidemic is affecting Palestinians and how it's making them more susceptible to death from coronavirus. I think by you also indirectly you debunked some of the myths we have. For example, since at the beginning of the outbreak in Palestine, we had the myth that Gaza is actually lucky because it's under blockade and so will be immune. And when you said that Gaza is an artificially created space, or it's a well-engineered reality, in a way, it's important to note that actually Gaza is not lucky, because for having been under a severe blockade for more than 13, 14 years. And drawing on this, the role of Israel and settler colonialism, Yara, I want to ask you, what is Israel's responsibility as an occupying power in this situation? What should be expected from an occupying power?
Yeah, first, I want to say thanks to Al-Shabaka for having me. And Noor, thank you for this important question. I've seen it discussed quite a bit recently. I would say broadly, Israel's responsibility towards Palestinians in this case rests on three factors. So there's the humanitarian or moral argument. There's two, the practical reality of infectious disease. Three is the legal argument that rests on international humanitarian law, or IHL. And I'll touch on the legal argument last for reasons that I'll make clear as I describe the others. There's so much to say here, but I'll stick to the basics to be mindful of time, so please feel free to follow up in the Q&A. So first, the humanitarian argument. Before we touch on any legal definitions, any debates, any politics, we must be clear that there's no doubt that any entity has more control over everyday Palestinian life than the State of Israel. With few exceptions, Israel mandates who Bank, Jerusalem, and Strip, including humanitarian aid in this case. If you control a population's movement, as Israel has in the form of curfews, manned border crossings and checkpoints, a complex permit system, the separation wall, of course, the blockade of Gaza, and the geographic segregation of the West Bank by the expanding settlement infrastructure, you control their health. You control whether or not they can import the concrete to build a medical school or clinic, whether they can send medical technicians for training, whether they can bring in foreign doctors for workshops and conferences, whether they can, just as Osama said, have adequately stocked pharmacies and hospitals. You even control their ability to get food and water. So when the rules and guidelines that you set tangibly influence whether a population will get the masks, gloves, soaps, ventilators that they need, you have a responsibility for their health. So that's the moral argument, right? Israel should support Palestinian health because they have a unique ability to do so based on factors I'll touch on in a minute. And it's the right thing to do in this crisis situation. So then I'll touch on the practical reality. Just 2 weeks ago, the coordinator of government activities in the territories, which is the Israeli military body that coordinates with the PA, the Palestinian Authority, said viruses and diseases have no borders. And so prevention of an outbreak of the coronavirus in Gaza and the West Bank are a prime Israeli interest. And that's undeniable, even if you have one of the most heavily manned borders in the world, as Israel does. Thousands of Palestinians from the West Bank work in Israel every day. Hundreds of thousands of Israelis live in settlements in the West Bank. Israeli soldiers are still patrolling the West Bank, conducting raids and demolitions, and they're still manning the border crossings. Hundreds of people from Gaza and the West Bank enter Israel every year to get cancer treatments or other forms of advanced care that they can't get in the territories. So these populations are intertwined, and as long as that's the case, there is no end to the virus in either population unless they can control it in both. So it is undeniably in Israel's best interest to keep COVID-19 out of the population of the Palestinians, if for no other reason than to protect their own. So lastly, there is the legal argument. This is where it gets messy, right? Since the Six-Day War of 1967, after Israel captured the Sinai Peninsula, the Golan Heights, Gaza Strip, and the West Bank, of course, the United Nations and almost all legal and international bodies have recognized the West Bank and Gaza Strip to be occupied territory and Israel as the occupying power in legal terms. In this frame, Article 55 of the Fourth Geneva Convention stipulates that the occupying power has the duty of ensuring the food and medical supplies of the occupied population, while Article 56 mandates that the occupying power has the duty of ensuring and maintaining, with the cooperation of national and local authorities, the medical and hospital establishments and services, public health, and hygiene in the occupied territory. As recently as March 19th, at the beginning of this crisis, the UN re-emphasized Israel's duty in this case as the occupying power to ensure that all necessary preventive means available are utilized to protect Palestinian health. However, historically, Israel has, at best, only tacitly accepted these premises. Many in Israel argue that the West Bank is not even occupied, the land is merely disputed, or that any obligation as the occupying power was displaced by the Oslo process in the mid-1990s, which, let's remember, was meant to be an interim process to begin with. Additionally, Israel contends that because they pulled their troops and settlements from within Gaza in 2005, Gaza is no longer occupied, even though Israel controls the airspace, sea access, and one of the two land borders of the territory. This is an argument you're really starting to hear in right-wing governments around the world, including within the United States. I want to make clear that the international community does not agree with any of these framings and maintain that Israel's responsibilities as the occupying power should be intact. Yet, these same international bodies have done almost nothing to counter what they themselves claim are Israeli violations of legal obligations for decades, aside from occasional statements of condemnation, and thus they've enabled Israel's lack of recognition of their responsibilities as the occupying power. When Israel does provide Palestinians with aid or some sort of economic or social support, it's never with acknowledgement of their legal obligations. It's almost always because of some practical or political need to do so. So do I bring up the legal argument last because it's the least important? No, of course not. I emphasize the humanitarian and practical arguments because in a pandemic, time is of the essence. I believe that to the Israelis, the legal framework is the least compelling of the three arguments because of the failure of this argument in preventing hundreds of previous violations. The UN rapporteur for the situation of human rights in the Palestinian territory has previously, before COVID, noted that Israel is in profound breach of its international obligations with regards to the health of Palestinians. So I think this cooperation and collaboration we're seeing today between Israel and the PA and even with Hamas has little to do with acknowledging their international obligations and more to do with a pragmatic understanding of how infectious disease works.
Thank you, Yara. So practically speaking, how has Israel so far responded to the epidemic in Palestine, specifically in the West Bank, in the Gaza Strip, with respect to Palestinian refugees, Palestinian prisoners, Palestinian citizens of Israel, etc.? What has been Israel's response so far?
So even in the framing of the question, you can hear how complex this situation is. There's so many populations, they're so segregated. First, I really want to counter this fallacy that I've read in some of the early pieces about COVID-19 in Israel and Palestine, which is this kind of notion that Israel and Palestine are these neighbors, and isn't it so great to see these warring states put their differences aside and fight this, invisible enemy? And this is just wrong in many respects. These are not two sovereign neighbors, as Osama said, on equal footing, where one is just a little more rich than the other or more developed. So this talk of Israel, supporting or helping the PA in this situation, it kind of misstates or outright ignores these legal responsibilities. While this novel coronavirus is a force of nature, which is in many ways occupation blockade are the result of man's choices that we continue to make daily. I don't want to insinuate that the cooperation that does exist between the PA and Israel is not significant and vital, because it absolutely is, especially in this crisis moment. But remember that when China or someone wants to send in masks or ventilators to Palestinians, or even if the World Health Organization or UNRWA wants to do it, they have to coordinate with Israel to get the goods to Palestinians. So as you stated, there's a few distinct groups that I'm going to touch on. One is the Palestinians in the West Bank and Gaza, and East Jerusalem, sorry. One is Palestinians in Israeli prisons. then Palestinians in Gaza, and lastly, the Palestinian refugees. So first, let's talk about the West Bank. On March 22nd, right after this had kind of hit this global peak of panic, the COVID-19 situation, the Palestinian Prime Minister instituted a 2-week throughout the bank after the first few cases detected in Bethlehem. The PA knew immediately they did not have the capacity to handle an outbreak, so they moved very quickly to put these movement restrictions in place. 2 days later, on March 24th, a Palestinian man working in Israel without a permit was reported to authorities for displaying symptoms. So he was taken to a checkpoint back in the West Bank, dropped off, and passed out there. On March 26th, Israeli forces demolished a building and seized several tents in a village in the Jordan Valley. On March 31st, Israeli police raided 2 Palestinian neighborhoods and a refugee camp, and they arrested more than 15 people just on that day. These stories go on and on. So in the West Bank, it's business as usual, except that the Israeli soldiers are wearing masks and sometimes hazmat suits. This is not to say that Israel has not been working to contain the virus in the West Bank. They are sending in testing kits. They are sending in ventilators and disinfecting materials. They've been conducting trainings. They're setting up mobile testing in East Jerusalem. But without ending all of the non-essential excursions into the West Bank, they're continuing to provide avenues to spread this virus. On April 2nd, just last week, they said they would halt demolitions because there was an international uproar about this, of inhabited structures. But this was after they'd already made dozens of Palestinians, including children, homeless during this pandemic, and seized goods that were brought in to build mobile health clinics. And whether the structure is inhabited or not, if you're bringing in soldiers and construction equipment, you're just bringing in more vectors of potential transmission within the West Bank. So there are currently about 5,000 Palestinians in Israeli prisons, and this includes 1,000 women, children, and infirm. Prisoners are typically held in crowded cells, limited access to any sanitation. While they're continuing to arrest Palestinians from the West Bank, there are new guidelines that they must now be quarantined for 14 days before they're even interrogated, and this is assuming there is a crime to be charged with. There have been family visits have been banned. Prisoners can only speak with their lawyers on the phone. Several Israeli prison guards have already tested positive for the virus. So while it's difficult to argue that a state is not responsible for the life of a person they're incarcerating, what we've seen in recent weeks is Palestinian prisoners released into the West Bank and then testing positive for COVID the next day after showing symptoms. Article 13 of the Third Geneva Convention mandates that a detaining power is prohibited from seriously endangering the health of a prisoner. So this adds another wrinkle to the legal argument. I think in terms of Gaza, the first thing we need to do is understand that 2 months ago, Gaza was already one of the worst places on earth to get sick. 50% unemployment, very high poverty, very high food insecurity. 97% of the water is not suitable for drinking. I mean, it's I'm sure we'll talk more about Gaza later, but it's a bad situation for just normal healthcare system. Unlike most other places where we've seen COVID, this is not the environment that the virus is creating. This is the environment that the virus is entering. So this is an environment that is densely packed with people already suffering from limited access to all social determinants of health. So Gaza is a huge concern. And I think of the territories, this is the one that I've heard most people voice concern about. Israel has been bringing testing its sanitation equipment and protective gear for health workers into Gaza, and the UN has praised this unprecedented cooperation between Israel and the Palestinians. But it's important to remember that Israel is also facing the same crisis. So this isn't just a political or security situation. The Palestinians can't depend on Israel here because Israel also needs ventilators and masks, and they need their own medical staff, and they need to be quarantining as well. So although testing within the territories and for the Palestinian citizens of Israel has not met demand, and health information was not available in Arabic, and officials in Gaza long accused Israel of rationing medical supplies to around 45% of need, the reality right now is that Israel also needs the same supplies, so we can't just depend on them. I'll end with Palestinian refugees. They and other displaced and stateless populations are among the most vulnerable in the world, refugees and displaced people of all kinds. The camps are overcrowded, water and soap are not in high supply, available healthcare infrastructure is extremely weak. And Israel, in this case, sees itself as having very little responsibility for their care. The states where many of them reside, such as Lebanon, have historically denied them access to healthcare services. The 19 camps within the West Bank are already seeing high unemployment. I think we've heard of very few cases in the camps, and I would be wondering if that's because of low testing or because they're so isolated that for now it has not entered. While the UNRWA is trying to provide services and disinfect homes, the most important thing we can all do, which is the social distancing that we're all doing, is impossible in a refugee camp. You have multiple generations of a family living in a very small space, and if even one person in that family can't avoid going to work, they're a vendor, they're a fisherman, that includes the risk for the whole family. So overall, you're seeing high vulnerability across all Palestinian populations. And while Israel is working in some respects with some of these populations, true containment would only be seen with actions like freeing prisoners, easing or lifting the blockade of Gaza, containing their settler population, which continues to harass Palestinians in the West Bank, and ceasing all non-emergency excursions into the West Bank. Yet most of these ideas would not even be entertained by anyone in the Israeli government today.
Thank you so much, Yara. I'm pretty sure this raises also many other questions that we can talk about in the Q&A. But I have a practical question drawing on some of the points you raised. If there's an outbreak or an increase in the number of cases, Osama, where do Palestinians get ventilators from? Or how about the testing kits? Can you tell us more about the supply chain mechanism? And how is the PA, generally speaking, how is the PA preparing itself for a potential outbreak?
Okay, so yeah, that's also a very, thank you, Noor, a very important question. Again, as I said before, this whole crisis just reveals us and puts on top of the surface a lot of problems that are being faced every day by Palestinians in the West Bank and Gaza, mainly the lack of sovereignty and also the lack of the lack of sovereignty, as in you do not have industrial territories that you have. You don't have factories for your own stuff that you control, and in terms of what kind of production, what kind of pharma industry you have, and so on. So the PA has actually published an emergency response plan where it stated that it only has 175 ventilators in the West Bank and 120 in Gaza. These are incredibly low numbers for such a, like, I think 3 million population in the West Bank and almost 2 million in Gaza. And it had called for an emergency platform called the Palestine COVID Coordination Platform, where it called for donors and people that are interested and involved in the healthcare of Palestinian to do chip in and donate, and it has a plan for trying to import 1,200 IC intensive care unit beds, including ventilators and monitors, where they have only 225 intensive care unit beds. And they called for 500,000 testing kits for COVID. Of course, again, having no control over having no airports and no control over ports and so on, all of that will have to be under the supervision of Israel. So if we saw the World Health Organization did donate a few thousand testing kits to the West Bank, which have arrived through Jordan, and then with Israeli coordination, the Chinese are supposed to send again more something like 10,000 testing kits for COVID, which will land in Ben Gurion Airport and then are supposed to be transmitted. So basically, everything has to be under the control and coordination of your occupier. Right, which is a very, it just emphasizes how absurd the situation is when someone that is your occupier, that regularly, bombs you and kill you, is in charge of providing you with healthcare and with health services. So there is a plan. Of course, we don't know how that plan is, how much money they will be able to bring, or how many donations, but there is some kind of plan that is trying to emerge. Another thing that we need, so if we look at Israel, what it is doing. In Israel, there's a huge discussion about having their own production line, and they are shifting entire industries and shifting lines, especially the military industry, into creating, building ventilators, and and to transforming specified hospitals to corona hospitals, and so on. So, that just makes it more sharp how Palestinians imagine if we had our own industries, if we really controlled raw materials that we have, or engineering, or whatever, how we as a sovereign nation could have dealt with that, and how now we're just fighting for or calling for donations, and for really reinforcing our relationship with the outside world as basically beggars in a way. We just we call for help. Of course, that reinforces our being occupied.
Thank you, Osama. Just a quick reminder to the audience that you can ask the questions using the feature at the bottom of the screen, ask a question, or you can actually vote for a question, because I will be asking the questions to Yara and Osama based on the number of votes. So if there's a question that is important for you, just vote so that the question is asked. And I'm just going to ask one more question to Yara, and then give the floor to the audience. So the COVID-19 pandemic has revealed and deepened existing structural inequalities all over the world. We're seeing that the impact of this epidemic is not evenly distributed, and is highly determined by where one lives, the kind of job one has, the gender, race, class position, etc. Yara, what issues are being amplified in Palestine, and what are the social, economic, and political challenges facing Palestinians, and how do you think might the pandemic exacerbate existing inequalities?
Excellent question. We could have a whole lab on just this question. So I will not be able to touch on every aspect of inequality, because so many inequalities were already so entrenched, again, prior to COVID-19. So I think one thing about this kind of trauma, especially this kind of massive, highly disruptive, acute global crisis, I mean, how rare is it that we're all kind of experiencing the same trauma, is that it does have this unique ability to point to the cracks and inequalities in society. And we're seeing this all throughout the developed world, including right where I'm sitting in the US. To an extent, we are also seeing this in Palestine. But the primary difference is that the pre-existing inequalities in Palestine are all due to man-made conditions: colonization, military occupation, and blockade. Palestinians who are in their 20s today lived through the second Intifada, and their parents lived through the first, and their grandparents lived through the Six-Day War, and the generation before that witnessed the Nakba itself. A 12-year-old in Gaza today has lived through 3 wars. So none of them have lived in a sovereign state with a functioning economy and the freedom and dignity that up until a few weeks ago, many of us took for granted. For most of us, hopefully, these restrictions will be lifted in a few weeks or months. Worst case, a year, 18 months, it sounds like a long time. But for Palestinians, while the worst of these restrictions may be lifted, the wall will not come down after COVID-19. The checkpoints will not be dismantled after COVID-19. Palestinian doctors were low on supplies before COVID-19, and they will be after as well if the status quo is permitted to continue. So let's keep those just base inequalities in mind. I think one inequality, a primary inequality that has been brought back into the spotlight, is the blockade of Gaza. Now, of course, to those in Gaza, this is in the spotlight every single day, right? Before COVID-19, Gaza was barred from importing chlorine, hydrogen peroxide, materials for disinfectants, or much of the equipment needed to repair broken ventilators that they had, or generators for electricity, because Israel recognized them as dual-use items that could be used to make weapons. As with the coronavirus itself, these shortages and these potential negative outcomes were apparent. Gaza have been warning fears that an infectious disease outbreak would be devastating, and that they were not ready. We've had progressive senators and members of the US Congress call for the blockade to be lifted, but this is one of the major inequalities in Palestinian society and the Palestinian population. Then you have the economic challenges brought by COVID-19. So they're landing on an already depressed Palestinian economy. Now, of course, this is not the first time that the Palestinian economy has gone through a dip, but the swift and indefinite closure of tourism, education, trade, and service sectors to COVID-19 is much different than a typical political or security disruption. In the best case scenario, I was reading an economic analysis where the pandemic is, let's say, 2 months, which at this point sounds very optimistic. Palestinian GDP for 2020 would decrease by 2.2%. Per capita income would decrease by 4.5%. Unemployment will skyrocket, and public deficits, which are already a huge problem for the PA, will increase. While donors provided a boost of aid in the early 2000s to bolster the Palestinian economy, after this pandemic, everyone is going to need aid, especially low middle income states. And the nations that are the typical donors are also going through the same crisis. They're also facing their own economic uncertainties. To minimize this risk of economic collapse, Israel transferred $30 million of the PA's tax money that it has been withholding, but they're still holding more than $100 million. The Israeli finance minister characterized this as emergency aid, but it isn't aid. It's Palestinian tax money collected and held by Israel. So if we can get anything out of this crisis, I think this makes it abundantly clear that a quasi-state dependent on aid in the context of occupation is not sustainable, especially in a crisis. And that throwing inconsistent amounts of money at this problem with a tensely worded statement or something has been the extent of many states' foreign policy response to the Palestinians for years. I'll touch on one last inequality, which is the labor force. More than 150,000 Palestinians from the West Bank work in Israel, and this has been one of the primary vectors of transmission into the West Bank. In fact, the first COVID-19 death in the West Bank was a 60-year-old woman who was thought to have gotten the virus from her son, who was a day laborer in Israel. Palestinian leaders have called for all of these workers to return to the West Bank to self-isolate, but Israel's construction industry has said the damage would be too great. Aside from construction and agricultural jobs, Palestinian citizens of Israel are working as doctors, like Osama, nurses, and other frontline workers in Israeli hospitals. But while they work side by side with their Jewish colleagues, the prime minister of the state where they hold citizenship, Benjamin Netanyahu, has leaned heavily on inciting against Arabs, insinuating that they will steal elections or that they're terrorists. Now he's depending on these Arabs, which make up 17% of doctors in Israel, to serve as part of the backstop against this global crisis. So I also think it will be interesting to see the relationship between the Israeli right wing and their Palestinian citizens. I think it's the most important thing is we have to remember the Palestinians are at a man-made deficit. To fight this next global crisis, whether it's climate change or another pandemic or whatever is coming, because something will come, we need empowered citizens and institutions in sovereign states that trust each other and cooperate. So hopefully this crisis shows us that there's no reason Palestine cannot be a functional member of that group.
I hope so. And maybe we can discuss in the Q&A the role that the PA can play also in addressing these inequalities. But related to that, we have a question by Nadia regarding local community initiatives. So Nadia is asking, we read about creative efforts in both besieged Gaza and the occupied West Bank that are transforming existing small industries to produce masks, protective clothing, and even ventilators, and making enough products to export to Israel and beyond. Osama, how much can this help in this crisis? And what do you think, broadly speaking, of these local community initiatives in helping us throughout this crisis?
Okay, yeah, thank you for the question, Nadia. It's very important. While it is, we are always busy analyzing the building stock, these brutal policies that cause so much violence, we need to remember that Palestinians have a very long tradition of resisting these violences by having their own initiatives, and this echoes a very long initiatives even in the when Palestinians were, at some of their worst times as refugees in Lebanon, largely in the camps, they were doing amazing job in terms of healthcare. Some of it even much better than what we have now. There was a very progressive clinic that were run by the population itself, by nurses and doctors, largely by the Red Crescent, and they truly saw that as the embryo of the future Palestinian state. So they had a very strong network of having medical services, and I think they still do in some of the refugee camps. And that has then transformed to a lot of political parties that had their own medical relief networks, also the PFLP, Fatah, Hamas, and so on. So there's a very large infrastructure of community-based networks, and also in the simple cases, of caring for each other when you know that someone is handicapped in the neighborhood or elderly, so you need to take care of food supplies and medications and so on. So we saw, like, in times of crises, just as Palestinians are very well familiar with lockdowns, with curfews during the Intifada, invasions, and in this crisis, you see beautiful initiatives of factories that are shifting their production lines also to making protective equipment, medical for health workers, also making masks, community efforts. Also in 48 Palestinians living inside Israel, they started their own initiatives of redistributing food supplies, of also translating materials that was missing in Arabics. So there's a very strong social cohesion that can try to uplift a bit of all this tragedy. But it is never it will never stand up to the amount of if you talk about state policies that can really have massive production lines. But these are beautiful and very organic initiatives, and it shows the best of society.
Exactly, that we should keep on doing. Yeah, there's a question that I think on misinformation that I think you can maybe answer. So Kim is asking, to what extent is misinformation being spread on social media, specifically across the occupied Palestinian territories? What misinformation is of most concern, and where is this coming from? I know you were interviewed in an article by 972 magazine, so maybe you can also draw on that.
Yeah, I would. First off, that's a great question. I will refer initially, if you're really interested in this topic, the article was written March 16th on 972 by Henriette Shacker. So if this is a topic that interests you, I encourage you to check out that piece. I think we are seeing misinformation widely. If I'm looking at this factor specifically to the Palestinian case, public opinion polls for years have shown very low trust in authorities, the PA included, Abbas specifically, the UN. I mean, you have to think of what Palestinians have been told and promised over decades, very little of which has come to pass, except for the worst case scenarios. Those always tend to happen. So I think this is a population that's inherently skeptical of just decrees from on high. So there is, and I won't even repeat the specific misinformation because I don't want anyone to get any ideas, but in terms of cures, things that may cure it, you're seeing a lot of that, especially on WhatsApp groups. You're seeing just doubt and misinformation. Where did the virus come from? Who started it? Was there a political motive? That kind of gossip. But again, sitting here in the US, I'm hearing the very same myths and fairy tales as well. But I think that for the Palestinians, I just saw a poll from this weekend that showed, so I had to read it like 3 times, that showed like something like 92% of Palestinians in the West Bank approve of how the PA is handling this. Don't quote the number, but it's above 90%. And I have never seen such a number. So I think that the population now, I mean, they see this is happening everywhere in the world. This is not something that the PA or Israel is telling them. Everybody is locked down everywhere. And 2, I think that inherently Palestinians know that their social cannot handle a break. So even if there's a chance that, well, I'm not sure if this is true. I'm not sure if there's a cure, but just in case, I'm going to stay home because I know the health system can't handle it. So I think some of the misinformation is being tackled, again, by the reality that if there is an outbreak, everybody knows that it will not go well.
Mm-hmm. So thank you, Yara. And there's a question related to on the public opinion in Palestine about how the PA is handling it. So it's maybe, Osama, you can address this question. So Muriel is asking, Muriel is saying, we hear that public opinion in Palestine has changed considerably with regards to the Palestinian Authority, and in particular, the Prime Minister, due to his handling of the crisis. Could you provide some background and differentiation? Osama?
Yes. So as Yara mentioned, can you hear me?
Yes.
Yes. Okay. So I will. Okay, as Yara mentioned, true. Palestinians are inherently skeptical of of responses by authority people, especially the PA. And but I think even in I recall the early days when the pandemic started, we were even planning a conference for Palestinian medical students inside in Haifa, just to talk about these issues of structural violences and so on. And that conference was still, the Israeli regulations were still not canceling event, and not things were going a bit as normal, while in the West Bank they shut down everything. And when I talked to some healthcare officials, whether aren't they being too aggressive or too violent, the immediate answer was no. We know that our system is extremely fragile. We know that we cannot afford to miss anything. And I think in that sense, it was a very wise decision taken from a very early stage to say, no, we know that we cannot handle this on any level. We cannot afford, if you look at what's happening in Italy and New York and so on. So they shut down everything quite fast. I think that was, and it has proven to be, a good decision. So in that sense, I think, yes, there was a certain level of professionality in dealing with the crisis in Gaza. But again, in times of crisis, I think we all know how to really hold on to. It's a kind of survival instinct, to say that we. So in this specific case, yes, there has a kind of approval of policies, something that I cannot say about Palestinians in Israel, because Palestinians inside Israel has been subjected to a very racialized policy by the Israeli government. So while Israel knows that 20% of its population is Palestinians and Arabic speaking naturally, and a lot of the celebrated workforce in the hospitals are being Palestinians, and now we're having all these headlines about cooperation and working hand in hand. So while Israel has been celebrating its Palestinian doctors and nurses and pharmacists, it has completely ignored the existence of this population. So it did not publish any material in Arabic in the beginning. It took until independent Palestinian bodies starting publishing in Arabic. It did, until now, it tested very little Palestinian, and it had very limited testing point in Palestinian towns. And I think here you can have similar parallels. So Palestinians inside Israel were also, not reliant on the state and inherently skeptical. So they kind of took better care of themselves, and because obviously they saw that they were being neglected by by the state.
And in a sense, this racialized policy by Israel towards Palestinian citizens of Israel echoes colonial histories and how other settler colonies also dealt with the outbreak of an epidemic through racialized and militarized policies as well. So there's a question from Ellen. She's asking, what can we, solidarity activists in the international community, do? What should be the focus of our campaigning? What are the priorities? Thank you so much, Ellen, for asking this question. Maybe Yara, you can address it, especially because you're based in the US and you were involved with the solidarity activism there.
Absolutely. So I think this is an excellent question, and it's hard right now. Not everyone has effort and energy and money to give to other causes. So Elaine, I appreciate you asking, and especially in this time when it's so much needed. I would say since we're kind of all trapped in our homes right now, there's two things that you can do, maybe three things. There's, of course, online organizing and solidarity. So there's many, many groups that are active on Twitter for all aspects of Palestinian life. There's groups that advocate for the educational sector, for the health sector, for the Palestinians within Israel, etc. So get involved in one of those groups, absolutely, and they can give you some targeted measures to go with. I would say too, if you have money to give at this moment, you can donate to groups that are working on the ground, and make sure that you do a little research. But Medical Aid for Palestinians is working very hard in the territories right now. And of course, you can donate to UNRWA, which supports the refugees. And there's several organizations that your money will go much further, because it will actually help the Palestinians on the ground. Not all such charities are in this way. And I think one easy thing we can do, and something we could have all been doing months ago, but contacting your politicians. If you're in the US, contact your senators or congresspeople. If you're outside of the US, the equivalent in your locality or in your state or in your province, contact them and make sure that they know that this is still on the radar, that the blockade of Gaza is unacceptable, that aid needs to be reinstated to Palestinians, especially if you are in a country that has pulled back from supporting Palestinians in recent years, like the United States. I think there has been so many crises, especially in the Middle East, that it's easy to lose focus. So I think if citizens show that this is still an issue, this is still a crisis that we're paying attention to, these inequalities were unacceptable before and we still think they're unacceptable, I think that your voices and your support would be very important in this moment when there's so many other competing priorities.
Thank you, Yara. So there's a question from Daniel about the relations between the PA government in the West Bank and Gaza. So he's asking, can you tell us more about the cooperation between the Ministry of Health in Gaza and the Ministry of Health in the West Bank, and how are they, if there is any, cooperating in the fight against the spread of COVID-19 across Palestine? We've heard the PNA sent to Gaza 1,000 test kits. Do you have any more insights regarding this issue? Osama, do you have any insights on the level of coordination between the two ministries of health?
Yes. Okay. So before I want to address also the previous question regarding what people can do for Palestine. So it's really important now that we're seeing echoes about the call to lifting sanctions and boycotts from on Iran, Venezuela, and Cuba, and so on. This is another opportunity to remind the world that Gaza is still under siege and Gaza is still under blockade. And the solution to Gaza is not giving it money or donation and so on, is giving it freedom and blocking the siege. And historically speaking, the right of return, right, to all Palestinian refugees, so they can enjoy their lands. And once again, we need to emphasize that although this crisis is creating this kind of theatrical form of disease and death, where you have an audience at home watching and counting by the number of deaths in other parts of the world, but also in Palestine, we need to remember that Palestinians die on daily basis and on regular basis, also from bombardments and shooting and so on, but also from avoidable diseases like uncontrolled diabetes or uncontrolled hypertension and heart diseases that could have been easily solved. And these easily treated diseases take so much death toll and so much and cause so much despair and mortality and disabilities on daily basis. So it's really important to take this opportunity to remind the world that after COVID will be over, all of this still goes in the background and has been killing Palestinians in much larger number. So regarding the question, about the coordination between the PA and Gaza. Yes, this is another incredibly disturbing aspect of that makes Palestinian lives even much more complicated. During my previous visits to Gaza hospitals, one of the major points to tackle was this synchronization between so you have two ministries of health. You have the Hamas Ministry of Health in Gaza and the PA Ministry of Health from Ramallah, and some of the employees in the healthcare and in the hospital and in the clinic, in this also very chaotic network. Some of them are employed by Hamas and some of them are employed by the PA, and there's a lot of not tension on the daily basis, but tensions in terms of how you would expect them to be when you have several bosses and several appointments. So who's in charge of promotion, who's in charge of doing policies, and who is in charge if some doctors or healthcare workers will get a permit to go and do some kind of course in Israel or in Jordan or in Gaza. So who's in charge of the permits? So that is on top of all the difficulties that Palestinians in Gaza face. I think the division between Fatah and Hamas and had an incredible toll, and that was when we started to have some kind of plan, a working plan for how to make the situation a bit, try to tackle it in Gaza. This was one of the major points to address. It's very problematic on many levels. A lot of them are logistic and administrative, but that is translated to facts on the ground in terms of how in terms of policy planning, and one of the, as I said, we have this image of what is livelihood in Gaza and what is how Gaza is unlivable, and of course you have everything regarding poverty and water being unsustainable, undrinkable, and awful crowdedness. But I think what was most hurtful being in Gaza was this lack of certainty regarding planning. You really cannot plan anything in life. Also, as individuals, you cannot have long-term plans because you're always in between two wars, two diseases, two military assaults. You really don't have control over your life. And from the very basic, everyday life of people to health policymakers who cannot plan what to do, and who are they coordinating with the PA and Ramallah, or with Israel, or with Egypt, or with other donors. So everything becomes double complicated and clumsy, and that of course is translated to more misery on the patient side.
Thank you, Osama. There's a question from Kayan. How is Israel taking advantage of the pandemic to further the occupation of Palestine, specifically with regards to attacks and arrests? So maybe you can, Yara, answer this question, building on your answer to a question I previously asked about how Israel is responding to the epidemic in the OPT. You're muted.
Sorry, there I am.
Yeah.
So this is such a complex question, especially because this is happening in the midst of Israeli elections, all sorts of behind the scenes, it's a very complicated time in politics right now. I have seen many, many articles with headings like coronavirus saved Netanyahu, COVID-19 saved Netanyahu's career. And just yesterday, we heard that Netanyahu and Gantz formed an agreement about annexation within the West Bank. This was yesterday, and you can be forgiven for not hearing about it because the whole news is focused on COVID right now. So that's the fear with these kinds of authoritarian states, is that they use these times of emergency and crisis when everyone is stressed, everyone is making quick decisions, people aren't really looking at long-term, to make changes that they think will be long-term. So I think that there is a fear that earlier I said, for most of us, the movement restrictions will be raised. I think some Palestinians are concerned that for some of them, they may not, that this enhanced form of lockdown will be sustained with some sort of health justification, public health, hygiene justification, something like that. We are also still seeing demolitions within the West Bank. And again, these are, page 15 of any article or news about the region, just because of COVID right now. There are still high-profile arrests happening, and all of this is happening under the cover of COVID-19. And they're putting not just Palestinians, they're putting Israelis at risk by continuing these actions. I think if they were truly serious about containment, this would be the last thing on their mind if we want to really preserve public health. So I think that, none of this is new. I want to emphasize the demolitions were happening, the raids were happening, the shortages were happening. I think the fear is that when this is over, what will it look like? Will they be annexing in the summer, as this plan seems to be? What will the summer look like? Will the movement restrictions be lifted? There's so many unknowns right now. I think the fear is that in this kind of frame of uncertainty and unpredictability, especially with a newly empowered Netanyahu, that bodes very poorly for Palestinians, I would say, in the fall and beyond.
And Yara, there's a question related to the point you raised about the legal responsibility of Israel as an occupying power. So Bettina is asking, who is legally responsible for testing and treating Palestinian workers returning home to the West Bank from Israel? Do you have a specific answer to that?
So the Geneva Convention, Article 13 of the Third Geneva Convention, mandates that when you're detaining someone, you cannot seriously endanger their health. Okay, so that has, but that's been the case for Palestinian prisoners. Their health has long been endangered. So they have long not met this obligation to protect Palestinian prisoner health. Now what we're seeing, which is quite worrying, I think it was last week around Ramallah, where a Palestinian prisoner was released. He was showing symptoms, but he had not been tested in Israel. Once he was tested in the West Bank, he tested positive. But now he's in the West Bank. So now it's the West Bank's responsibility. I would say incarcerated prisoners and the newly released, especially if they're coming out with a health condition that they contracted from the prison, IHL would say that that is Israel's responsibility. But as I stated and made clear, that has rarely led to the outcomes that we would think that IHL would provide. So in my mind, and what I imagine would be the minds of most international bodies, the prisoners and the health of the prisoners and the safety of the prisoners is Israel's responsibility. But if they're releasing them into the West Bank, at that point, they have changed the facts on the ground. This is something they're very good at.
And speaking of Palestinian prisoners, Sarah is asking if there is any sign that the Israelis might release Palestinian prisoners during the crisis. Osama, how would you respond to that? Is there any sign that...
Yeah, I think you need to be extremely naive to think that this crisis will bring us all together as one big happy family fighting the virus, of course. So, and especially when talking about the prisoners. So the health of the prisoner has been an burning issue, for so long, and we know that even like before countries and nation in that sense are fighting for resources and trying to take everything. Prisoners in the Israeli healthcare system have very little access to specialized doctors, to doctors and nurses in general. Many of the doctors that are in charge of the prisons are not a part of the Israeli Medical Association, so they're also not held accountable to the same ethical standards that physicians and doctors inside in Israel are work. So it's an entire kind of black hole in terms of services, and we know that the health of prisoners were used also as as kind of political tool for pressuring prisoners and so on. So to expect that all of that was happening in the background will suddenly disappear and now Israel try to release prisoners, I would be very doubtful. And if it does, I would see it as a public relation stunt, something to a bit to whitewash its image, and as it has often did.
Thank you, Osama. So one last question. We have many more, but unfortunately we're running out of time. So Kiran has a question regarding which underground organizations in Gaza or in the West Bank would need immediate support in terms of either additional funds or to raise more awareness of the work they are doing. Yara, you mentioned Medical Aid for Palestine, and they are doing an incredible job on the ground. Other organizations you think should be, that you would suggest to be supported in Gaza or the West Bank? Yara, Osama?
Yeah, I actually just saw two in the comments that I'd wish I'd mentioned. The one is Defense for Children, that specifically advocates for children that have been detained in Israeli prisons, but also just does good work for children. And then there's the Palestine Children's Relief Fund, PCRF. They regularly are helping Palestinian children with getting prosthetics and getting all sorts of advanced health needs. So they are really doing on the ground work. But Osama, being in the region, I would also defer to you to know some of the on the ground organizations that are less internationally known.
Yeah. Also, the UNRWA does a very good job in Gaza, and the MSF, Physicians Without Borders. But I'm not sure if MSF is currently active on the COVID. They do a lot regarding the amputations of legs and parts after the Great March of Return. But Medical Aid for Palestine has been doing an amazing job also in terms of services and in terms of reporting and campaigning. So these are, incredibly important.
Thank you. Thank you so much, Osama and Yara. This was a very informative and insightful discussion. Thank you for joining us, Yara and Osama. Thank you for our audience. Thank you for asking all the questions. We tried to cover too many different dimensions and aspects. We talked about the role of Israel's settler-colonial enterprise in shaping Palestinian bodies and Palestinians' habitats or environments, so that Palestinians have become, as Osama said, a more diseased population that is more susceptible to become affected by COVID-19. Yara talked about Israel's responsibility as an occupying power during this outbreak, mentioning humanitarian, practical, and legal arguments. We also tried to debunk some myths about the exceptionalism of Gaza being lucky, or about the PA and Israel working as neighbors. We also critically examined Israel's response to the epidemic, trying to cover the different geographic units, fragmented units that Palestinians are living in, and this fragmented geography and with fragmented politics have heavily shaped the response of the PA and Israel to the outbreak. We also touched upon how this COVID-19 outbreak has revealed and has entrenched structural inequalities in all parts of the world, and especially in Palestine. We also talked about the role of local community initiatives and the importance of networks of social cohesion in helping us in this crisis, keeping in mind that this would never, as Osama mentioned, this can never replace the role that a state should play, although the lack of Palestinian sovereignty over its population and over territory has been paralyzing and undermining what the Palestinian government could do. More questions should have been asked if we had more time on what the PA should be doing more. The Palestinian workers in Israel, Palestinian informal workers who found themselves with no jobs overnight. I don't know if the Palestinian government has any specific plan to address the challenges that they are facing. We will hopefully address these questions in an upcoming commentary or policy brief that we are working on as part of Al-Shabaka. So please stay tuned. If you like these policy labs that we're having, please don't forget to donate, because it's through your donations that we can keep on working. We will send you an email with information about the future policy lab, which is going to be on the ICC investigation, another very important topic. But for the time being, please stay safe, stay well and healthy. And thank you again for joining us. Have a good day. Osama.
Thank you so much, Noor and Osama. Thanks, everyone.
Do you want to add 2 points? Yes.
Okay, a small thing I would like to add is that as we know, the COVID, the risk of dying from the corona is much higher when you're above 80 at a larger age. And sort of like a lot of the Palestinians, they do not live up, being a much more diseased population, you know, unfortunately, do not live up to be 80 and then die from corona. So we need to look at, sometimes you have these paradoxical protective factors. So of course, we all hope that corona, the pandemic, does not kill a lot of people. But if we look at the numbers a few months from now and are surprised, we need to remember that paradoxically, being much more diseased and not living up to an older age might paradoxically, you know, cause you not dying from corona. That's not a good thing per se, but here it might play with the numbers. And also we need to look at the numbers of, you know, in Italy, they recently published some data where also deaths from COVID increased, but deaths from non-COVID also significantly increased. So we need to be extra careful in the future how we analyze the results of this pandemic, and to understand that also statistics and maps can be a very problematic tool of, and we need to really pay special attention in how we analyze numbers and results in the future. Exactly. And of course, thank you for hosting us and the audience.
Yeah, I think it's a very good way to end the discussion by reminding the audience and ourselves that maps can be very deceptive on so many fronts, as and statistics. Unfortunately, we don't have the time to discuss this and many other issues, but thank you so much again, Yara and Osama, for your time. And thank you to our audience for joining us and asking the questions. I hope this was informative. Have a good day. Stay healthy. Goodbye.
Thank you. You too, Noor. Bye.